Boston Healthcare for the Homeless provides high-quality health care to some of the city's most vulnerable residents. Last year marked the program's 40 years of service. Our Erica Tarantel introduces us to founding physician Dr. Jim O'Connell.
It was during the mid-'80s when dueling health crises struck Boston's ballooning homeless population, tuberculosis and the AIDS epidemic. Little did Dr. Jim O'Connell know then that those factors would help shape his entire career. Just outside his office are photos he's taken in the years since.
There's tons of stories here.
They're of his patients, all unhoused. He has 40 years of stories.
We know that your first impression of somebody you see on the streets is invariably wrong.
Fresh out of residency with plans to become an oncologist, the Harvard-educated doctor said yes for a year to a job the city was struggling to fill. Founding physician of Boston Healthcare for the Homeless program, BHCHP.
You could do anything for a year, I thought, and then I would just go on with my career.
Funded by a grant, the program's goal was to deliver continuity of care for unhoused people.
I didn't know anything about homelessness, so this was just a chance to be a doctor in a world I didn't know at all.
Having never been inside a shelter, he was suddenly thrust into a clinic at the Pine Street Inn.
And you know, Pine Street back then had about 600 or 700, maybe 800 people there. It was huge. I walked through the door and it was sheer chaos.
It was also there where he met life-changing mentor Barbara McGinnis, who led a team of nurses.
Barbara gently told me, as she took away my stethoscope and all the stuff that would doctor, that I would have to sit and just learn from them. And she made me be an apprentice for the first 2 months and soak feet.
The challenges of those early days responding to TB and AIDS and the mandate to provide continuous care convinced Dr. O'Connell to stay on.
And they were begging for us, the health system, to treat them like we treat everybody else. The last thing they wanted was a series of rotating doctors and nurses who they didn't know.
Now, 4 decades after that first year, Dr. O'Connell has helped to shepherd many first. The first respite program in the country for homeless patients.
But if you can imagine, you're sick in the hospital, they're going to discharge you, but you have no place to go.
The first street teams, doctors and nurses going out to meet patients where they are. The nation's first homeless program to use electronic medical records.
We now have, 30 doctors, 40 nurse practitioners and PAs, 100 or so nurses, untold numbers of caseworkers and staff, all devoted to the continuity of care for this very, very marginalized population. And we are part of the mainstream.
BHCHP has its own space and it runs clinics in shelters, but also in hospitals at Boston Medical Center and at Mass General Brigham.
That's, mind-blowing for me. So we've been blessed all these years to be part of those systems. I don't know any place else in the country where that happens.
While Dr. O'Connell believes homelessness is, in a way, worse than it was when BHCHP began, he says there's a special resilience that keeps his team going.
We're doctors and nurses. We can't make society all of a sudden build homes and get everybody in housing, but we can take care of people. Beneath the tragedy of all this, and it is, believe me, a societal tragedy, there is the ability to make relationships that really sustain clinicians who are there to help and try to, we're there to heal, sometimes to cure, but, that's what it is.
Our thanks to Erica for that story. Housing and support are key foundations for a stronger community. Coming up, the Central Massachusetts organization that is addressing homelessness with services, advocacy, and education.